Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. This meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. Last Friday, Governor Newsom announced new state authority for reopening a new round of businesses across a wide variety of sectors beginning as early as this Friday, June 12th. The new businesses include hotels, which had previously been limited to only essential travel, but now may have authority to reopen fully for tourism and individual leisure. Visit Santa Barbara has now published an online guide entitled How to Be a Healthy Traveler in Santa Barbara. That will help a lot with visitors who are joining us new at the hotels. Gyms and fitness centers have also been authorized to reopen, along with indoor museums and zoos. Bars and wineries may also now open without the requirement of offering food to customers. Finally, campgrounds and outdoor recreation will also be allowed to reopen. These new sectors will be reopened only upon approval of the county health officer following his review of local data, including positive cases per 100,000 population and percentage rate of test positivity, and our local preparedness to support a healthcare surge, protect vulnerable populations, and deliver effective contact tracing and testing services. Governor Newsom is continuing to keep the following businesses closed at this time across the state of California: personal services such as nail salons, tattoo parlors, body waxing, saunas, and steam rooms; indoor playgrounds such as bounce centers, ball pits, and laser tag; movie theaters, live theater, and concert venues; nightclubs, festivals, and theme parks; and higher education for in-person participation. The County Public Health Department has already begun making the necessary preparations to issue a local public health order later this week that would complete the authority necessary to reopen the businesses listed by Governor Newsom. Dr. Anzar will be continuously monitoring all of the new data that become available this week to ensure our county is maintaining the metrics required by the state of California to reopen. A decision on the range and pace of reopening will be made later in the week and will be announced by press release or at our next press conference on Friday. The county reopening and recovery ambassadors reported another good weekend working with local businesses to ensure that they are operating safely and smoothly with the new health protocols necessary to protect all of us. Business owners and customers have consistently offered thanks for the extra care the county is offering and providing to help local businesses reopen safely. Many people are out shopping, dining, and recreating while wearing face coverings where required and consistently practicing physical distancing. If you want to help local businesses survive this very difficult moment, please give your financial support to your favorite local business. If you aren't yet entirely comfortable with visiting the store or restaurant in person, please call and buy a gift certificate to share with a friend or for later use. The recovery of local businesses is at a critical stage right now, and every business needs our loyal patronage and support. As the school year draws to a close, I'd like to highlight the Food Bank of Santa Barbara County's Picnic in the Park Children's Summer Lunch Program. Picnic in the Park will provide free, healthy lunches for kids 18 and under, Monday through Friday from June 8th to August 7th at 10 locations countywide. Picnic in the Park locations at easily accessible parks, libraries, and churches are operated by volunteers who provide lunches and help ensure kids are protected from community transmission of coronavirus through the use of sanitizer, physical distancing, and the use of PPE among adults and volunteers. This year, the food bank is working with Revolution Foods to provide fresh, plant-based, kid-friendly lunches prepared with fresh ingredients. Thanks to the food bank's partnership with No Kid Hungry, Information about all locations where children can receive free lunch this summer may be found by texting summer food to 877-877. That's summer food texted to 877-877 and entering an address to find the nearest lunch locations. Individuals interested in volunteering, donating, or finding a food distribution site for Picnic in the Park should visit foodbanksbc.org. That's foodbanksbc.org for more information. We'll now hear from Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. Today, we are reporting 9 new COVID-19 cases. We have 43 patients in the hospital, with 9 in the intensive care unit. As Supervisor Hart mentioned, the state has released guidance on a wide array of industry sectors on how to reopen with modifications, potentially as soon as this coming Friday. The County of Santa Barbara has received the variance attestation from the state, and with it, the privilege for the Public Health Department to decide when these sectors are allowed to open. These sectors are all out of stage 3 of the reopening guidance. We will be convening this Wednesday for a thorough review of our cases, our hospitalization numbers, and outbreak situations in congregate living situations. Providing we are still in compliance with the variance requirements, we plan to issue a new health officer order this Wednesday, amending the stay-at-home order and allowing for more business sectors to open, providing they self-attest on our website, readysbc.org. We understand that until we have a medication or a vaccine against this virus, there will be new infections. All of us have adjusted to wearing masks, keeping a physical distance, and washing our hands frequently. We do have to strike a balance between opening our industries back up, let kids go to summer day camps, planning for school openings for the new school year, and making sure we are not experiencing an unmanageable surge in new cases with severe illness and death. We did see the effect our openings over Memorial Day weekend had on our COVID cases as a slight increase in hospitalization numbers. However, it has been manageable. Please understand that the risk for infection is still very real, and the best protection is ongoing physical distancing, hand washing, and wearing of masks. Thank you for your continued cooperation.
Thank you, Dr. Ansorg. Next, we'll hear from Dr. Vonda Reynoso, the county's public health director.
Thank you. Good afternoon. One of the critical areas that we all worry about is the disease transmission in the skilled nursing facilities because of the vulnerable residents living in these facilities. As part of the state variance attestation for our county to reopen, we are working with skilled nursing facilities on their plans to do baseline testing and surveillance testing. By the end of June, all 14 of our local skilled nursing facilities will complete baseline COVID-19 testing for their residents and their staff. This means roughly 1,000 residents and approximately 2,000 staff will be tested. According to the California Department of Public Health, because of the congregate living situation, an outbreak is defined as 1 positive test in a skilled nursing facility. You can find the list of skilled nursing facilities experiencing outbreaks at the CDPH website. Additionally, in the next few days, we are working to list the facilities in our county that have experienced or are experiencing outbreaks on our reopening metrics dashboard at www.publichealthsbc.org. We are working very closely with 2 local skilled nursing facilities that have active outbreaks at Country Oaks and at Valley Verde. Rehabilitation facilities and nursing homes present a challenge for health officials because of the population that reside there are older, less healthy, and live in close proximity. The county prioritizes investigations in these facilities due to the high risk of serious illness that outbreaks pose. Outbreaks in a skilled nursing facility are a very serious situation and shows why we all must take steps to protect our most vulnerable community members. As we move forward, we encourage everyone to stay connected by visiting our website, particularly our reopening metrics dashboard, to keep up to date on the progress of our community is in making during this pandemic. Additionally, the county call center remains open Monday through Friday, 9:30 to 5:30 p.m. and can be reached by calling 1-833-688-5551. Thank you.
Thank you, Dr. Dorenoso. I also invited Major Jessica Carr from the Salvation Army to talk about the community work they are doing to respond to the COVID-19 pandemic. In addition to their regular services, the Salvation Army has dramatically changed their focus to bring to bear resources available to feed hungry neighbors in need. The local South County Salvation Army is working with more than 7,000 local families, providing food and housing assistance. 98% of these families have never asked for assistance from the Salvation Army before the COVID-19 pandemic. In response, the Salvation Army has already provided tens of thousands of meals to families that need help. Thank you, Major Carr, for all that you're doing and for joining us today.
You're welcome. I'm honored to be here today. Thank you, Supervisor, for inviting me. As mentioned, the Salvation Army of Santa Barbara County has been going full force since this epidemic crisis began. You'll know we have an office in Santa Maria, and they've been providing hot meals and delivered of those hot lunches. They have showers, they have utility and rental assistance, and they continue to provide all of these things along with food boxes and hygiene kits. Here in South County, we normally have an after-school program, and they had to suspend the services because our community said that they were hungry. And so we stepped up, we partnered with the food bank and other local stores to get food to all of the families. So we are thrilled that we have met so many new people have come to our sites, and we have served countywide over 72,000 meals in the last 12 weeks, 3 months. We've had over 14,000 food boxes that have gone out. We've had to scale back a little because as the food bank has struggled to get food and we've struggled to get food, but our numbers have just continued to grow and grow and grow. Here in South County, we serve 240 families on Friday. That's just Friday. So our new days in South County are Tuesdays, Wednesdays, and Fridays. And I think we're the only food pantry open in the evening. So Wednesday evenings from 5:30 to 7:30, families can drive or just walk up, and we put food directly in their little cart or directly into their car. And it's really great. The Berryman people, the Berryman company has been providing us with 38-pound boxes of fresh produce. My volunteers are tired of lifting those 38 pounds of boxes. So, but the vegetables are great. We love it. And we are here to feed the need, if you will. We're excited. We're in the process doing all of the paperwork so that we can reopen our summer day camp program and our fall after school program. We're going through the process. So we're excited to be here. Thank you.
Thank you, Major Carr, for all the work that you're doing in our community to help our neighbors in need. We're so fortunate to live in a county that has so many committed, caring people working smart, hard, and collaboratively to address the human needs exacerbated by the economic dislocation from the COVID-19 pandemic. Thank you for all your work.
Thank you.
We'll now go to questions from the room. Ms. Lair?
Dr. Dorenoso, can you talk about whether any of the elder care homes in Santa Maria are a part of the recent, I think on Friday it went up by 50 in Santa Maria, and we're just trying to see if from your data dashboard you found any correlation to why still Santa Maria seems to have high numbers.
So from what I'm hearing, You're asking
little
about
bit
skilled
of-
nursing facilities in Santa Maria.
But the ones you mentioned are in Santa Barbara, correct?
No, Country Oaks is in Santa Maria.
Ah,
Right, and so there is, so that's the portion. And the other portion is, are the cases in Santa Maria. So some of the cases are in Santa Maria. And so we are putting the final touches on our in-depth profile of the cases in Santa Maria. So we are doing one last look, checking all of our data, and we will be sending out the study to the public, I believe sometime this week. So, and in that is a retrospective survey of our Santa Maria cases for profession, for living, for work, for knowledge of social distancing, face covering, hand washing, and other factors. So it should give us an insight.
and could either of you, including Dr. Answer, comment on whether there's been any contact tracing linked to many new restaurants or stores that have opened with new cases? I mean, or can you even give out that information?
So I can take a stab at it. So we are doing contact tracing with all of our positive cases. And to the best of my knowledge, no one place has been identified. So we know that the transmission happens through close contact, through droplets. And so it is community spread. And so it's hard to pinpoint a cluster of what's happening that's attributable to any one place.
Thank you.
Next, we'll go to questions on the phone.
Yeah, so today, just to let everyone know that our audio is not coming in. They can hear us, we can't hear them, so I'm going to read their questions. The first one is for Ms. Carr from the Salvation Army. Reza with the San Ynez Valley Star would like to know if there are any Salvation Army services in San Ynez Valley.
So unfortunately, the services had to be postponed for now. I don't have the exact details of when they will restart, but I can tell you that we in Santa Barbara, as well as the Santa Maria team, have been happy to serve anyone who comes. We're serving people from Lompoc, the whole valley, and if they come, we feed them. If they come from even another county, we feed them once and then tell them where they're to go. I don't like to turn away people who are hungry, so I'll give you food, but then direct you to the proper. But the valley can come to us.
Thank you. This next question is from Tom Bolton at Newshawk for Dr. Ann Sorg. We've seen a fair number of new cases in the last few days, including about 50 on Friday and nearly 30 since then. Can you provide a little more detail about the increase you are seeing from the Memorial Day weekend and what you expect from all the protests?
Yeah, of course. The opening of businesses will have had a small increase in cases. I would say that one time the 50 and of new cases in one day, and then today we only had 9 cases, so it evens out that we actually don't have, on an average, we don't have that many more cases from before opening. And with regard to the protests, it is too soon because they just started 10 days ago, and infectious period is 2 weeks, so we will see by next week what effect that had. The slight uptick in hospitalizations, I presume, has something to do with our wider opening of, people moving around more. But fortunately, it's been very manageable. As you can see, our intensive care unit cases have dropped quite significantly, which is really reassuring. So I'm actually quite optimistic at the moment that the measures to open up were timed perfectly and have not done significant harm so far, and therefore we'll be very eager to see when we meet on Wednesday to decide what to do for Friday.
You know, Dr. Ansorg, I took my daughter to the youth-led protests on Sunday, and we spent, 4 hours? And even though there were, I'm guesstimating around 2,000 people, I kept looking over the crowd and from different angles. Everyone was wearing face coverings. So like you, I'm very optimistic that we will not see a huge impact from the protests.
Great, thank you for that.
The next question is actually just worded differently. First from Laura Place, Santa Maria Times, and Lauren with Ed Hat. Dr. Van Dovernoso, can you elaborate on how many positive COVID-19 cases within Country Oaks and Valley Verde?
Yes, so as of noon today, we have 5 staff and 5 residents at Country Oaks and 1 positive case at Valle Verde.
Thank you. And then from Tom Bolton at Newshawk, can you give an idea what people can expect when they return to their gyms once they reopen?
The workout will be a lot harder.
Yeah, it will be interesting because there are really quite stringent measures in place if they want to reattest for opening. Fitness centers, they have to disinfect their equipment all the time. It's quite interesting. So if you are so inclined, you can look it up on the website from CDPH, what the requirements are for the individual industries. It's open for everyone to review. And I think it's part of the new normal. Restaurants look differently when you go in. I was at my dentist today for a dental hygiene appointment, and I thought I was on a different planet because the people, the dentists and the hygienists looked like aliens with all their wear, and it was quite impressive. They had a huge exhaust pipe that they call the elephant hose, but it really is a large hose in front of the patient's face to suck up all the excretions and so forth. So they have made enormous changes and modifications to their usual or previous operations. And I would bet you that it's going to look quite alien in the beginning at the gyms as well.
Thank you. That is all the questions that we have.
Thank you to everyone who has taken advantage of the free COVID-19 testing services available around the county. Please continue to help the County Public Health Department and our community by taking full advantage of the free COVID-19 testing available at the state testing sites in Santa Maria, Solvang, and Santa Barbara. The state of California is monitoring the number of tests that we conduct locally, and the California Department of Public Health is holding us accountable to keep a high local testing rate. The local rate of testing is one of the metrics the county has attested to and is part of the evaluation system that is required to continue to reopen more businesses in the county. Testing is done 12 hours a day from 7 a.m. to 7 p.m., 7 days a week. To make an appointment, go online to lhi.care/COVID testing or call 888-634-1123. As always, please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and don't touch your face and disinfect surfaces. If you feel sick, stay home and isolate yourself. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Our next press conference will be Friday at 4:30 p.m. As always, if you have any questions, call the county's call center number at 833-688-5551. Please be considerate, kind, and safe. Remember, we're all in this together, and we will get through this together. Thank you for joining us today.